Hello friends, welcome back to my YouTube channel. And today, for all my friends who are looking towards surgery for the urethral stricture and have been wondering what our OIU is or what does endoscopic urethral stricture surgery mean, so in today's video I will demonstrate to you live how the surgery is done, what we see inside, and what should you expect if you are undergoing an OIU. So today we have a 35-year-old gentleman who has two strictures, one big stricture at the joint of his bulb and his penis and one at his penile urethra. This patient has two options, one to undergo an OIU or an endoscopic surgery. Endoscopic surgery, which is a daycare process, takes 5 to 10 minutes. The patient can go home on the same day and the patient can void well. On the other hand, if the OIU fails, and then he would require a bigger surgery known as a urethroplasty, of which also I have a lot of videos. OIU is a wonderful surgery if done by the right surgeon, done well, done carefully, and it can take care of your strictures very well. So here you can see that with an endoscope or a cystoscope, we have entered inside the patient's penis, inside his urethra. Here you see a knife. This knife is basically a cold knife. A cold knife basically means it's a sharp knife which does not have any heating element or a cautery attached to it. Here you can see that I am cutting open the stricture, and the shaded area basically shows that a stricture opens up, and this area of whiteness is basically area of fibrosis, or this is the area where the patient has a stricture. Here you can see that when we re-enter, there is bleeding from this raw surface. Bleeding from the raw surface means that this area is still healthy and the mucosa or the live tissue will be able to grow over this area, and the patient will get good result from his endoscopic surgery. On the left side top, you can also see the red dot. The red dot is basically telling you that where I am live inside the urethra as of now. So here you can see that his stricture has now involved a very long segment of his urethra. Here you can see that how my hands carefully move inside the patient's penis without causing any injury. Doing the OIU softly, doing it with sharp instruments, doing it with good instruments is absolutely essential. Otherwise, a badly done OIU can not only increase your stricture but can also cause other major problems. Here you can see that I have cut away on the stricture, and there is a lot of fine blood vessels which are going to be bleeding, and these fine blood vessels are actually good because they will be providing nutrition to our stricture to heal. It looks red, it looks bloody, but this means that we have now come to our densest or the tightest part of our stricture. And as you see, as we are continuing with the water irrigation and as it clears out, so here you see, look at this. Look at the dense, small, tight. So in any stricture, it is the tightest or the smallest part which causes the maximum difficulty. So here you can see exactly is the densest part or the narrowest part of the stricture. And once we cut through this, the patient will get a lot of relief in his voiding. So we just can't forcefully enter anywhere. We have to be very careful, and the cuts need to be very delicate. So here you see that we are delicately opening up the stricture segment. We don't have to force anything. We don't have to push anything. We have to be gentle. We have to do it with love, because that is what is going to give us long-term relief. There are new adjunct therapies which can help in improving or increasing our success rate with OIUs. These injective procedures may include buccal mucosal graft, cell cultures, or liquid grafts. It may also include steroid injections to hasten up the healing process. So here we have reached the patient's sphincter or the external sphincter. This external sphincter and this structure in front of you is the VOIU or the prostatic duct from where the patient normally excretes out his semen, and it is very essential that we do not do any intervention in this area. This is the patient's prostate. So many patients who have long-term strictures and are obstructed will have these enlarged prostate glands, and these prostate glands are important because after the surgery they may be a very important reason for continuing obstruction. Here you can see that we have entered the patient's bladder, and now the surgery is over. Now it is time for me to come out of the urethra gently. We will start seeing the prostate, the VOIU, our cut segments, and we now have a wide open urethra from which the patient will void well. Now I am going to put in a Foley's catheter, leave it in for 24 to 48 hours, and after this the patient should void well and should be cured of his stricture for the long time. If you have a stricture and looking for good surgery, economical surgery, then my center may be a good choice. Thank you. Keep sharing. Love you all.